Post hair transplantation surgery instructions. Let's quickly go through the instructions to be followed post your hair transplantation surgery. A lot of us are falling prey to the fake clinics which don't even give you the basic but crucial information about the instructions after the surgeries. Things to do, things you should not do. These all instructions are very important to keep your hair transplantation good and to get a beautiful hair transplantation results. Hi, this is Sohail Khan. Welcome to my show. This is Telugu Hair Transplant Helpline. Instruction number 1. So you chose a clinic and your hair transplantation is done. So the first instruction to you. Your return home journey is only by a AC vehicle and driven by somebody else. Self-driving is strictly not allowed after the surgery. And avoid head injuries. Stepping into the car and stepping out of your car, and when you're getting into the house where the doors heights are very small, so when you're entering and getting out, be careful with your scalp because they have just implanted so many grafts out here and an injury there could spoil your hair transplant. Avoid keeping your head in a stiff posture like this, Why? Because transplantation is just done and we were instructed not to, shake your head too much and, don't cough too much, all that. Because they have just put in the grafts there and your doctors do not want any bad impact there or any disturbance of the newly transplanted. So you tend to keep your neck very stiff and move around. Don't do that. You can keep your neck free and you can turn around slowly. What they actually mean is that like a severe head shake, something like that is to be avoided. In fact, if you do that, your neck will pain more. And don't bend your neck too much down for longer time. For example, we tend to work on our mobiles or laptops, keeping our posture like this down for quite longer time. So don't do that immediately after the surgery, at least for a week or so. Reason being, when you put your head down for quite long time, because the natural saline which they injected on the scalp, it will tend to form here and it will create a swelling on your eyes and forehead, down the eyes and above eyes. So you should not do that. Soon after the hair transplantation, try not to catch the cold and fever. And do not lift heavy items. Don't do that for a week. In rare cases, like 1 or 2 in 100, one might see the swelling on the forehead and near the eyes. That can be treated. Do not worry. Don't panic. So normally for us, the swelling indicates a bad health symptom. So in this particular case, it's nothing like that. It's only a saline water which is just flown in here. That will take its own time to get it absorbed in the body. So you don't have to really worry about it. That can be cured very easily once you get in touch with your doctor. Again, in rare cases like 1 or 2 in 100, might feel a headache and a migraine, these symptoms. So you don't have to again panic about it. So you can always get in touch with a doctor and clinic and that can be treated. While sleeping, don't place your bed sheet above your head and don't put your hands above your head because that might cause some kind of rupture to the newly transplanted hair. While sleeping sideways, be careful with the grafts which are coming into contact with the pillow. There might be some damage, so be careful. First 3-4 days, sleep straight, looking into the roof. Don't sleep sides. Or don't sleep turning around, straight. Your neck to the roof is the best posture for the first 3 days at least. For a week preferably. While sleeping, make sure your pillow is soft and make sure your pillow cover is changed almost every day. Don't wear t-shirts or vest. Wear a shirt with buttons at least for a week or 10 days. Why? Because while removing t-shirt and wearing t-shirt, it might actually, the t-shirt may come into contact with the newly planted hair and it may cause some loss. So don't do that. So after transplantation, at least for 2 to 3 months, you can use a basketball cotton cap for at least 2-3 months to avoid your scalp from exposure of direct sun and the dust. Strictly no hard exercises, jogging, running or weightlifting for at least 3 weeks post-surgery. Your day-to-day activities can be taken up like going to office and traveling to the local market, moving around, all that you can do. So post-surgery, first 3 days, you don't need to take any head wash. But after the 3rd day, maybe 4th, 5th day onwards, according to your doctor's advice, you need to wash your scalp and you need to do that every day from then on. Stop using all the other shampoos what we're using and use a mild shampoo, preferably Johnson and Johnson baby shampoo, for at least 2-3 months for your scalp and head wash. After 2-3 months, according to your doctor's advice, you can shift to some mild shampoos like Mildy, Anaphase or Relievers. Is only with lukewarm water and avoid salty water. Pour water over the scalp using a mug, as in don't straight away stand in front of a shower. Apply shampoo foam, let it soak for 2 minutes and wash it away by pouring a slow stream of water and keep it dry under a ceiling fan. Don't dry it with a dryer or never stand under a sun. After the head wash, don't massage or rub it vigorously at least for 2-3 days. After that, you can gently rub your scalp with a clean towel, cotton towel. So almost somewhere at 15th or 18th day, your head will be completely clean. All the swabs will be wiped out and it will appear very clean and neat. Wash your head daily as advised. For the first 6 months, no trimming and hair cutting is allowed and hair coloring is not allowed. Diet and medication has to be taken as prescribed, otherwise it will have an impact on your result. You can use a helmet after 1 month of the surgery, of course by using a handkerchief before using a helmet. Post surgery, from 2 weeks to 2 months time, there is a shedding period, as in all your implanted hair will fall and it will completely look empty. And don't panic, after that place is emptied only, the new hair will be popping up and that's a hair which is going to stay with you. So by seeing that, don't panic, not to worry at all, because it's normal. All the hair will again grow and that is a process. So the growth in transplanted hair is visibly seen only after 2-3 months of hair transplantation surgery. 6 to 8 months you will have a moderate results, as in moderate length of your hair, and around 10 months to 12 months you will have the fully grown result. You in fact need a good haircut and a trimming. This is a hair which is going to be with you and they'll grow non-stop, they'll be growing. After hair transplantation surgery, the PRP sessions is taken only on the advice of doctor. So if the doctor feels PRP is required for your hair and if the doctor strongly recommends, go for it. Otherwise, you don't need to really go for it, just the medication would do. Follow the doctor's advice. And immediately after surgery, avoid contacting your head again and again. You actually tend to put your hands on the scalp and sometimes scratch it. Do not do it because you might get infections and that's not good. So these are the important instructions. I'm sure you all will have customized instructions from your doctor as according to each individual. But these are the basic instructions which need to be given, and thanks to the real doctors who follow all this basic standard of instructions, and we all must follow this useful instructions for a good result of our hair transplantation. So in case if you have any queries, you can always get in touch with us. We will try to clarify all your queries, and that's all for today. This is Sohail Khan signing off.